Am I audible, no?
Uh, so, very good evening and namaskar. I, Dr. Latika Bharti, medical officer from Jammu Kashmir, welcome you all in the 17th Vishwa Ayurved Parishad Shalakya-Sambhasha. Under the vision Ayurveda at 2047, under the guidance of our National Executive Vishwa Ayurved Parishad Shalakya team and the national team of Shalakya-Sambhasha, Uh, today we have our guest speaker, Dr. Sarika, with us. Before we start this webinar, I would like to request all of you to join me for Dhanvantari Vandana, seeking the blessings of Lord Dhanvantari. I request all of you to please join us for Dhanvantari Vandana.
Namami Dhanvan.
Is it audible, ma'am?
Yes, yes.
Yes, yes.
Tarimadidevam Sura.
Is it audible?
Not audible now. No.
1 second.
Some lag is there.
I think network issue is there.
Namami Dhan.
Something is there, ma'am. Some problem is there, I think, ma'am. It's not audible, na?
No, it's not audible.
Not audible.
So we'll sing as it is.
Tarimadidevam
Sura Sure
Padmam
Loke Jararuk Bhayamrisham
Tunasham
Dhata Paramisham
Vividaushadinam Tatvaramisham
Sura
Vividaushadinam
Surirvandit Pad Padmam Loke.
Ma'am, I will pause it. Ma'am, I think there is some trouble in this, na? I'm just
Yeah. We will begin the session. Lord Dhanvantari is blessing with
yes,
us, so don't worry. Yeah.
No, ma'am, I will sing myself. This is my voice
Yeah.
only, but just not always. Namami Dhanvantari Madidevam Sura Surevandit Pad Padmam Loke Jararuk Bhaymrityunasham Dhataramisham Vividoshinam Dhataramisham Vividoshinam Chamvamavatavanivarivanhim Panch Prapanchatmak Deha Bhajam Santap Sampat Jara Jwarantakam Namami
Dhanvantari Padpat
Namami Dhanvantari
Devam
Mudakantikantam Shantam Haridwadashamakhyam Purtim Shatanam Sumanorathanam Namami Dhanvantari Namami Dhanvantari Devam Namami Dhanvantari Devam. Thank you and sorry for inconvenience.
Very sweet voice. Yeah, very melodious
So,
voice. No problem.
Thank you, ma'am. So now starting blessings of Lord Dhanvantari, I would like to request the National Co-Convener Vishwa Ayurved Parishad Shalakya Sambhasha, Dr. Sunita Magar ma'am, to kindly give the introduction of our today's guest speaker. Over to Dr. Sunita ma'am.
Thank you, Lotika ma'am. Good evening, our eminent guest speaker as well as national executives, coordinators of Vishwa Ayurved Parishada. Just now, Lotika has introduced me. I am Dr. Sunita Vijay Magar, national co-convener of Vishwa Ayurveda Parishad, and presently working at IMT Ayurved Medical College, Kharghar, Navi Mumbai, as a professor and senior consultant. So I took this to introduce our speaker, Dr. Sarika, because she is very much beloved to me. Belongs to Orange City, Nagpur. So this time from Vidarbha region, Orange City, Nagpur, I would welcome Dr. Sarika Chauri Palve ma'am. Now Palve ma'am to this Vishwa Ayurved Parishada's webinar, and the topic she has chosen, that is also very much important and very much relevant topic nowadays, because bridging the gap, that means bridging the gap between Ayurved practitioners and the patients. And as far as her introduction is concerned, Dr. Sarika Chaure Palve ma'am, she is presently working as a professor and head of the department uh, at Bhausaheb Ayurved Medical College, Nagpur. And she is not only an academician, but she is a researcher and clinician. At present, she has completed 16 years of her academic practice, being an academician, and more than 20 years as a clinician. Presently, she is pursuing her PhD at the College of Nagpur, PhD scholar. And, as she is a clinician and researcher, I told you, but what I would appreciate about her, she is a very sincere, hardworking, and she has reached to the needy people of tribal belt, Parshuni and Ramir. She has conducted ophthalmic camps, eye checkup camps, and she had made a record of checking her examination of the 1300 patients in a single day. She has outreached there, and that too in tribal area. And such kind of people are very much needed in our society. We are not conditioned and delivered our lecture, but I think this outreach activity makes her special. And not only that, she has conducted eye checkup camp, but she has presented a paper. Her observation she symposium was organized by all of Nagpur and NHS, and where she has that was the observation how we can reach to the needy people of the tribal area, right? Apart from that, being a professor and clinician, what is special about it? Her research contribution. So her research credentials are three patent, one copyright, and three chapter and books are published by her, and it is very much a proud thing that it is in such a very difficult to this thing. Secondly, she has completed three ongoing clinical trials. One clinical trial with Vico Bajrabanti, and not only with the Vico Bajrabanti, but that clinical trial was funded by Ayush. So Ministry of Ayush also. So that project, MHS granted funded project, and this is an amazing journey she has reached so far, and I really feel proud.
लगेंगे मुझे ना एक वेबिनार चला हुआ ऑनलाइन ना
अरुण कुमार जी आवाज आ रहा है शायद आपका. So it is my privilege. I really feel proud about her.
मैं तो आपको ना जब मैं फ्री होऊंगा तो मैं कॉल करता हूँ आपको, है ना.
किसके आवाज आ रही है?
जी मैम आप बोलिए प्लीज.
So I welcome Dr. Sarika ma'am to our today's very insightful session of the 2047. What Ayush Ministry and Modi ji has to gain, that we have to reach to the each and every needy people, और घर घर आयुर्वेद हमें पहुंचाना है. ये हमारा उद्देश्य है. उसी उद्देश्य के साथ हम लोगों को जो आउटरीच एक्टिविटी में जहाँ अपना काम लेके जाते हैं रिसर्च के, ऐसे स्पीकर को मैंने आज I took effort and she has agreed to join us. So welcome Dr. Sarika ma'am, and shall we start the session? You can share the screen. Okay.
Yes.
Thank you very much for giving me this opportunity. Okay.
Thank you, Magar ma'am, for such a lovely introduction. Am I audible?
Yes.
Yes, ma'am, you are.
Yeah. Thank you very much. A pleasant evening to all. As clouds gather outside, let's brighten our minds through our Sambhasha today. So, respected dignitaries, organizing team, and the esteemed colleagues and my dear students, I extend my heartfelt gratitude to the Vishwa Ayurved Parishad and the all entire organizing team of this Shalakya-Sambhasha for giving me this wonderful opportunity to be a part of this enriching academic platform. It's a truly an honor to be invited as a guest speaker among such learned and dedicated members of the Ayurvedic fraternity. A special note of thanks to respected Dr. Magar ma'am, whose kind support and encouragement made this opportunity possible for me. I sincerely appreciate her trust and thoughtfulness in me. So, I will share my screen and start with the topic. So, is it visible?
Yes, ma'am.
Yes.
Share. Uh, slide share, ma'am. Yes, ma'am.
Yeah. So, have you ever sneezed so many times in a row that it felt like you were leading an orchestra, a full-blown concert of the sneezes? So, this is the orchestra of sneezes or the concert of the sneezes. For many of our patients, this is not a just funny moment. It's a daily routine and they never ask for it. So it is a very awful moment for a patient to sneeze in a crowded people or in a meeting or in their day-to-day activities or in their office. It gives me a pleasure to speak today on a topic that affects millions silently but persistently. That is allergic rhinitis. Often brushed off as just a cold or a seasonal allergy, this condition is much more than a minor nuisance. It interferes with sleep, hampers productivity, reduces quality of life, and affects the Pranava Srotas and Urdhva Jatruga Sthana, the very foundation of our Shalakyatantra. The title of today's talk, Beyond the Sneeze, Bridging the Patient-Practitioner Gap in the Allergic Rhinitis, invites us to look beneath the surface because behind every sneeze, every itchy eyes, and every stuffy nose, there is a more frustrated patient, a clinical challenge, and a practitioner striving to offer more than just temporary relief. And somewhere in between lies a gap in communication, expectation, and integrated care. So, today we will explore ways to bridge this gap by understanding the clinical picture in depth, aligning patient needs, and Ayurvedic wisdom, and moving towards sustainable immunity boosting Vyadhi Pratyanic interventions that truly beyond the sneeze. So, this is the battle of sneeze, the sneezing symphony, sneezing fit that made you feel like you were conducting an orchestra, the Allegra of the Achus. So, allergic rhinitis is an IgE-mediated type 1 immediate hypersensitivity reaction characterized by inflammation of the nasal mucosa after exposure to inhaled allergens. So these are lecture objectives. At the end of this lecture, we will be able to learn about the fresh modern AI pathophysiology diagnostic guidelines based on the management to identify effective strategies to enhancing the patient-practitioner communication, to map the Ayurvedic concepts, that is the Nasagat Roga and Pratisha onto the immunological pathways, and summarize evidences of Nasya and Rasayana herbs as immunomodulators and the biomarker changes in it. So to discover ways to support practitioner in delivering comprehensive care. So this is the epidemiology and the impact of allergic rhinitis. 10 to 13% of the patient of the totally global prevalence is the 10 to 13%, depending on the age, geography, and the environmental exposure. So that trends is increasing in the urban India, based on the Isaac phase 3, sharp rise in the children and the adolescents. It is one of the most common chronic respiratory condition, often beginning in childhood and persisting on recurring adulthood. So, contributing factors include air pollution, indoor allergens, changing lifestyles, dietary habits, and the poor ventilation. So, it causes the economic burden on the direct, which may be direct or indirect cost. Direct cost, it may be cost of the medications, consultations, diagnostics, and the indirect cost, it hampers, that is the presentism, reduced work productivity, absenteeism, school or work days which are lost. So, and it also causes the impact on quality of life. That is the sleep disturbances, nasal blockage, post-nasal drip is there, cognitive impact, fatigue, poor concentration, emotional effects, irritability is there, social withdrawal is there. So, there is a progression risk. Allergic rhinitis always lead to or can be lead to chronic sinusitis. There is an increased risk of asthma based on the one airway, one disease model. Upper and lower airway are interconnected, and this managing allergic rhinitis can help to control the asthmas. So allergic rhinitis isn't just a nuisance cold, it's a chronic inflammatory condition with far-reaching personal and public health consequences. So this is the heat map of allergic rhinitis prevalence by the regions, and the graph shows the darker shades indicate higher prevalence, with South Asia, India notably at the top. This is the 30% prevalence globally. So what is the connection of nasal mucosa and allergy? So nasal mucosa act as a primary defense system, which nasal mucosa traps the airborne allergens, irritants, and it prevents them from entering the respiratory system. So impact of the allergic rhinitis is the, as we have discussed, that is, it is the 10 to 13% the global population and approximately 26% in the India, highlighting its widespread prevalence. And what is the AR? It is the condition that causes inflammation of the nasal mucosa, leading to the hallmark symptoms such as sneezing, nasal congestion, and the itching. So what happens inside your nose when you sneeze? So this is the allergic pathophysiology that happens in our nasal mucosa, and these are the phases. So this is the pathophysiology. So let me start with a common scenario. A patient walks in complaining of sneezing, itchy eyes, nasal congestion, and says it happens every time whenever there is a dust or pollen in the air. You suspect allergic rhinitis. But what really goes on inside their nose? So let's journey into the microscopic battlefield, the nasal mucosa. So this is the allergy drama, a battle inside the nose that happens in the allergic rhinitis. So think of the nasal lining. So this is the nasal mucosal lining, which acts as a smart defense system. But in some people, this is overreactive. So when allergens like pollen, dust mite debris, and the pet dander enters through the nose, immune system or immune surveillance begins. So these allergens are picked by the dendritic cells, little detectives, and presented to the native T cells of our immune system. So these are the dendritic cells activating, which catch the allergens, and they activate the T cells. So this is the early phase reaction we started here, and the drama begins. The T cells become Th2 cells, which act like overprotective commanders. They start releasing cytokinins. So they releases the cytokinins, which like IL-4 and IL-13, which command B cells to produce IgE antibodies. So highly specific to the allergens. IgE then goes and sits on the surface of the mast cells and the basophils. Essentially, alarming them or arming them. On the next exposure, that the same allergens bind to the IgE, they wounds the mast cells and the mast cell degranulates. So what happens on the degranulation? They releases the histamine, and this is the main symptoms. We started with the histamine action, and this is the what they causes. They causes the sneezing, itching, watery nasal discharge, nasal congestion, and this all acts due to the capillary. What happens? There is a vasodilatation, and they bring more fluid and the immune cells to the capillaries and to the nasal mucosa. So all this is a picture of continuous irritation of the nasal mucosa is there, and inflammation of there, continued inflammation, which causes the vessel dilatation or capillary dilatation, and that's why there is the nasal blockage. And this is the picture of the allergic rhinitis we can see, and this is the symptoms where patient gets frustrated or irritated. So what is the late phase reaction? These are the early phase reactions, and the late phase reactions are hours later, a second wave of immune soldiers arrives. Eosinophils, neutrophils, lymphocytes, they release inflammatory mediators like leukotrienes and the prostaglandins. So what is the result of the leukotrienes and the prostaglandins? There is the mucosal swelling, nasal blockage is there, thick mucus is there. So this is the late phase reactions, in which eosinophils, basophils, T cells infiltrate the mucosa, and the chronic inflammation of the mucosal priming is there. So one allergen exposure triggers a biphasic immune response, which ultimately leads into the immediate symptoms followed by the prolonged inflammation. So this is why patient often says, I wake up with a blocked nose every morning, or I can't smell anything properly. So this is the clinical implications or the clinical picture of the allergic rhinitis. So continuous and inflamed nasal mucosa, which causes, what happens here? There is a continuous mucus accumulated in the nasal cavity, nasal blockage is there, and due to the mucus, there is the blockage of the nasolacrimal duct, and the blockage of the nasolacrimal duct causes the accumulation of the tear in the eyes. So there is the watery eyes along with the nasal blockage, and the when there is a nerve irritation or nerve end irritation, so sneeze occurs. So this is the picture of allergic rhinitis, and these are the these are the comorbid conditions and the complication. Before that, so why do symptoms occur in the allergic rhinitis? So as we had discussed, this is the IgE mediated type 1 immediate hypersensitivity reaction characterized by inflammation of the nasal mucosa after exposure to inhaled allergens. So that whatever drama we have already seen in this picture, that causes the vasodilatation, nerve irritation, increased vascular permeability, and the mucosal gland stimulation. So because of this mechanism, these symptoms patient feels, or these are the symptoms, these are created in the nasal allergic rhinitis. So that is the sneezing, rhinorrhea, congestion, and the nasal drip, itchy eyes, and the conjunctivitis. Due to the blockage of the sinuses or improper drainage of the sinuses, there is a headache and the congestion. Sore throat is there. Snoring and mouth breathing. There is a continuous nasal blockage is there. So patient tries to respirate by mouth breathing, and due to the mouth breathing, there is a shushkata in all over oral cavity, and that's shushkata also causes the mukhapak may be there, ulcers may be there. So nasal blockage continuously, the mucus gets plugged into the eustachian tube, and the eustachian tube gets blocked. So eustachian tube blockage causes conducting hearing loss or the acute otitis media. So with that symptom, these are the comorbid conditions and the complications of the allergic rhinitis. So conjunctivitis, rhinosinusitis, turbinate hypertrophy, adenoid hypertrophy, hearing impairment or otitis media with effusion, laryngitis, and these are the impact of the allergic rhinitis, that is the asthma. It ultimately results into the asthma, atopic dermatitis, eosinophilic esophagitis, and the food allergy. So these are the primary impacts of the allergic rhinitis, that is we already discussed here. And these are the secondary, that is the decreased quality of life, adenoid hypertrophy, snoring, dental malocclusion, learning and attention impairments. So we discussed the symptoms. So these are the signs of the allergic rhinitis. The allergic shyness because of the vasodilatation, then denim organ lines, then allergic salute, continuous sneezing and nasal इसकी वजह से यहाँ पे कि allergic salute, then pale bluish boggy nasal mucosa is there, nasal crease due to this salute, this nasal transverse nasal crease is there, and the cobblestoning of the posterior pharyngeal wall. So these are the signs. So this is the clinical manifestation of that is the sneezing, what it happens, or because of which mechanism these symptoms were created, and this is the clinical appearance. So these are the associated systematic manifestations for the comorbidities. When eyes gets affected, it is the allergic conjunctivitis, red, itchy, watery eyes, ears, otitis media with effusion, lungs, wheezing, asthma symptoms are there, sleep, snoring, and daytime fatigue is there, learning, poor attention, skin, atopic dermatitis. So this is the classification of allergic rhinitis according to the symptoms, duration, and the severity. The seasonal allergic rhinitis that occurs during a particular season, caused by airborne mold spores or the pollens. The specific pollens which were released in the specific seasons, ऋतु परत्वे symptoms यहाँ पे create होते हैं, pollens from the trees, grass, and the weeds. So this is the seasonal allergic rhinitis. Perennial allergic rhinitis that occurs throughout the year, caused by dust mites, pet hair, or the dander, cockroaches, mold, sometimes from the underlying hidden food allergies. So according to the duration and the severity, it is classified into the intermittent symptoms and the persistent, mild, intermittent, persistent, and moderate severe symptoms. So if symptoms are less than 4 years per week and or less than 4 consecutive weeks, so it is called as the intermittent. And mild symptoms are there is a normal sleep, no impairment of daily activities, sports, leisure, normal work, school. So this is the mild symptoms. But if the symptoms persist for more than 4 days a week and more than 4 consecutive weeks, then it is the persistent allergic rhinitis. Whenever it hampers the sleep or impairment of the daily activities, sports, leisure, if there is a problem at work, so it is called as the moderate severe. So this is the updated classification of allergic rhinitis. That is, this is already we have discussed, but there is a key refinements there are, that is visual analog score. If this score is less than 5, it is we can say it is an intermittent, and if it is more than 5, it is a severe. So this is the classical correlation of allergic rhinitis, that is the ancient blueprint of modern allergy. So what happens? These are the triggers, or these are the villains that enters to our nasal cavity or nasal mucosa. So these are the common hetus or the common hetus of the pratishay. So out of this is a Dhuli Rajaha, then Rajo, Shite, Avashaya, Bashpa, Dhume. It can be correlated with the hetus, that is the triggers or the allergens. And that allergens, whenever they get into the plug into the nasal cavity, and there is the type 1 hypersensitivity, the lakshanas that create with allergic rhinitis, and this is the Vatach Pratishay, Doshach Kshavatu, and the Bhranshatu, which can be correlated to the allergic rhinitis. So what are the symptoms or lakshans in the Vatish Pratishay, Anadda Vida Nasa, Tanustrava. Anadda Vida Nasa, that is a continuous blockage of the nasal cavity is there. Tanustrava, that is the watery nose. Then Gala Talvoshta Shoshasha Vistudaha. So this will, it will be created due to the continuous mouth breathing. So this is the Shushkata because of the mouth breathing. Then Swaropadhatasya. So blockage of the stretching tube is there, and so because of the continuous mucosa of the nasal cavity, then sinuses and the nasopharynx. So these symptoms are created. So second one is the doshaj kshavatu. So what happens is there is a vata and prakopa, vata and kapha prakopa nidan hetus are there, and samprakti samprushya marmanya anilastu murdni vishwaka prathasya kshavatu karoti. So there is a irritation of nerve irritation is there, और श्रृंगाटक मर्म वहां पे एक्टिवेट हो जाता है, जिसकी वजह से यहाँ पे ग्रहणाश्रिते मर्मणि संप्रदुष्टे यस्य अनिलो नासिकया नरेति कफानुयातो बहुशा शब्दस्तु रोगमाहु क्षवतु विदिज्ञा. So this is the acute stage. We can say that dosha kshavathu, and this kshavathu narrated by the Sushruta is the acute condition. And that is the early phase reaction is there. But if we look in the this shloka, prabhashyate nasike yasya sandro vidabdo lavana kaphastu. So there is a tanu strava pravartini. This is the acute stage or the primary stage we can say. But sandra vidabdo lavana. So late stage, whenever there is a mucus is there or sinuses blockage is there. So this is the prabhashyate nasike yasya sandro vidabdo lavana. So this is the late stage we can say. So the specific chikitsa for the Vati Pradesha and the Kshavatu Prashantu, this part we will discuss later in details. But there is a Snigdha Dhuman. Snigdha Dhuman is specially suggested for the allergic rhinitis. So this is the correlation of our allergic rhinitis with our classical text. So एलर्जिक राइनाइटिस डायग्नोसिस एल्गोरिदम. डायग्नोसिस कैसे करना चाहिए? सबसे पहले जब पेशेंट आता है अकॉर्डिंग टू अपने पास आता है तो सबसे पहले क्या करेंगे? मेन इज द क्लिनिकल एग्जामिनेशन, डिटेल हिस्ट्री, एंड टू फॉर द कंफर्मेशन टेस्ट वी कैन डू द स्किन प्रिक टेस्ट इज देयर और स्पेसिफिक आईजी टेस्ट आर देयर. सो वो दोनों हम लोगों को ने करानी चाहिए. इफ बोथ आर नेगेटिव, सेकेंड स्टेप परफॉर्म नेजल साइटोलॉजी. If there is nasal eosinophilia, then third step perform nasal provocation test. That is to diagnose local allergic rhinitis. So these are the diagnostic techniques for allergic rhinitis. So this is the area 2023 guidelines. That is the diagnostic algorithm. So this is the first history. Then visual analog scale self-monitoring, and anterior rhinoscopy, nasal endoscopy if indicated. So confirmatory testing by skin prick testing, serum specific IgE. And for the specific diagnosis or the precise diagnosis, we have to rule out the non-allergic rhinitis, sinus diseases, adenoid hypertrophy. So differential diagnosis must be there and the confirmatory diagnosis should be done. So what is screen test? This is the SPT, that is the screen prick test or the puncture testing. It is a well-recognized, secure, reliable, simple and cost-efficient method to identify the allergen specifics. So specific allergen is pricked into the skin. Special markings are there, and the hypersensitivity reaction, will and flare reaction is observed. So this is the skin prick test. This is the patch testing. So, 65 different substances are placed at the back, and the allergic test is noted. So before we do the skin prick or the patch testing, the specific drug should be withheld before the skin prick test. That is the antihistaminics, we have to stop it before 72 or 96, that is the 3 to 4 days before, and the tricyclic antidepressant, it should be stopped before 7 to 14 days. So that is the confirmatory test, and these are the advanced diagnostic techniques in allergic rhinitis serology, that is the serology and the functional test. So what happens in serology? It is a specific IgE measurement based on the antigen antibody reaction. So these are the RAS, that is radio allegro-sorbent test. Then ELISA is there, FEI is there, and immunocap ISAC is there. These are the specific IgE measurements, and further advanced techniques, that are the functional test, that is the flow cytometry and the basophil activations. This goes beyond the specific IgE levels. It determines how allergens cause the symptoms. So in our mind, we have a specific map in our mind that the patient comes with allergic rhinitis. So we took the detailed clinical history, physical examination, and then we are done with the vivo testing, that is a screen prick test, vitro testing specific IgE measurements, and this is the algorithm in our mind, that is the diet management, occupational environment avoidance is given, then immunotherapy started, or specific pharmacotherapy. It may be modern or it may be Ayurved. But the actual picture, the current scenario is that. So what is the current scenario? So there is a disconnect in allergic rhinitis care. Patient is frustrated, often feels their concerns overlooked or misunderstood. There is a practitioner overload. Diagnostic gaps are there. So suboptimal care, and there is the ideal management, unsatisfactory health outcomes are there. So why there is a allergic rhinitis? Why battle is there in doctors and the patients? So allergic rhinitis having high prevalence but low awareness, overlapping symptoms with other conditions. Patients' non-adherence is there, limited access to advanced therapies. Then environmental and lifestyle factors are also contributing it. Lack of objective diagnostic tools. So if we think in the way of the patient or the patient's perspective, why doesn't this go away? हमेशा परेशान रहता है, जहां जाता हूँ मुझे छींके आती है, मैं परेशान रहता हूँ, जब भी देखो मुझे मेरी नाक बंद रहती है, मुझे सांस लेना नहीं जमता है, उससे मैं परेशान हूँ, or anything. So this is the overall frustration in the patient's mind. So what are the factors that contribute the frustration? That are the unmet needs, misconceptions, and the self-medication of the patient. Lack of clear information on allergic rhinitis, belief in quick fixes and not long-term solutions, reliance on the over-the-counter remedies, fear of side effects, then confusion about the cause. It is dust, it is food, or anything else. Overuse of the antihistaminics. Recurrence leads to the frustration, desire for root cause, and natural approach. So there is a challenge for the practitioner. So as a practitioner, we have time pressure. There is a complex diagnostic system. So we are confused, and there is a adherence of the care. So what should we do? There is a need to bridge this communication gap or to enhance the communication. So what should be done for the communication? There should be active listening. Patient जब अपना frustration लेके अपने पास आता है, we have to listen carefully each and every symptom of the patient, each and every cause he is stating, or whatever he is stating, we have to active listen. Then we have to suggest our suggestions or our prescriptions or whatever we are indicating him. We have to explain him in a simple language, explain conditions clearly, and there should be shared decisions that involve patients in our treatment choice. So what should be done for the enhanced communication with the patients? कई बार हम लोग पेशेंट को नेजल स्प्रे सजेस्ट करते हैं या प्रिस्क्राइब करते हैं, और उसके बाद पेशेंट को मतलब जस्ट उसको एक बार इंडिकेट किया ऐसे लेना है, but there should be standard SOPs for using the nasal sprays or nasal drops or whatever medicine we are giving to the patient. It should be clearly indicated. It should be every procedure should be clearly specified to the patients, and this is the clear indications for of using the nasal spray. So कई बार पेशेंट क्या करते हैं, नेजल स्प्रे लिया, ऐसे पेन जैसा लिया, नाक में डाला, और स्प्रे मेडिसिन कहाँ पे जाना चाहिए? It should be towards the back of the nose, so absorption will be there and action of the drug should be there. But what happens if there is a misuse or misdirected the nasal spray? So what happens? The medicine, active medicine goes to the nasal septum. So patient should be indicated with standard SOPs or procedure of using the any medicine, whatever he has been prescribed. So patient counseling should be proper. These are the some points or little things which should be done for the patient. So we can suggest them, keep symptom diary of pollen forecast app. क्या होता है, पेशेंट को खुद को मालूम नहीं कि कौन से एलर्जन से या किस पॉइंट से उनकी एलर्जी एग्रीगेट हो रही है या उनके सिम्टम्स बढ़ रहे हैं. सो फॉर दिस वी कैन सजेस्ट इन द कीप सिम्टम डायरी. सो these are the main points which should be communicate with the patients. So these are the communication techniques for the patient, that is the ask, tell and ask you technique. Plain language analogies. So simple language में patient को समझाना है. Nasal steroids are like moisturizer for inflamed linings. मतलब use करना है तो ऐसे use करना है. The visual aids, that is the allergen calendars, nasal spray diagrams, culturally tailored materials should be displayed in our clinics or multilingual leaflets as per the communication index. So these are the some things that we can enhance our communication with our patient. So we can empower our patients by using digital tools or developing some apps for it. Educational resources should be there, or self-management strategies. So user-friendly apps for symptom tracking, accessible online and offline learning material is there. Technically, techniques for daily symptoms and the managements. So for this, we can work as a collaborative or integrative approach in the management of the allergic rhinitis. So this collaborative care for improved allergic rhinitis outcomes and unfitted unified approach can significantly improve the lives of those with the allergic rhinitis. So this is the actual treatment algorithm in the modern era, or in modern pathy. So whatever treatment we are giving to the patient, it may be allopathy or it may be Ayurvedic. So this therapy aims to मतलब किन चीजों पे हम पे ध्यान देना है, that are the to prevent the allergen exposure. Then to block the mediators, that is the histamine and leukotrienes. If we block the histamine, early stage पे हम लोग उसको control कर सकते हैं. अगर यहाँ पे block नहीं किया तो leukotrienes को block करने की अपने को नौबत आती है. That is the late phase mediators. Then the reverse vascular congestion and to down the regulate inflammation. So the therapy, any therapy we are giving, it should be aimed to, or the protocol of the therapy should be this. So red flags and when to refer the patient. So whenever there is unilateral obstruction, epistaxis, severe headache, so it should be go to the ENT and imaging it should be there. Poor control, step-by-step therapy, allergist for skin prick testing, suspected severe asthma or lab. So it should be referred to the pulmonologist. कब हमें रुकना है और कब हमें पेशेंट को रेफर करना है, ये भी हम लोगों को पता होना चाहिए. So we should know our limit. So these are the clinical pearls. So symptoms, due treatment, intensity. Always anchor to the patient reported burden. So regularly reassess our goals. So it is a seasonal peak. So AR is a dynamic. So we always use the phrase, there are two experts here. to our patient that you about your life and me about the medicine. So this is a presentation of allergic patient. We already discussed it. So this is a diagnostic snapshot. If the symptoms more than 2 of classical quarter or more than 1 hour per day on the most days, so we should do for the screen prick test and the serum specific IgE levels we have to conduct and classify by pattern or by the severity, that is intermittent or persistent or mild or moderate. So management and the immunomodulation map for the allergic rhinitis, it should be first allergen avoidance, then diagnosis and pharmacotherapy and the immunomodulation by rasayan therapy, nasya, jalaniti, dinacharya, ritucharya palan, whatever we can collaborate with together. So allergen avoidance. These are the small tricky things that we can avoid the entry of the allergens. So minimize carpets and minimize furniture in our homes. Then cover the mattresses and pillows with the which is semi-plastic wording और allergens उस पे adhere नहीं हो सके उस तरह के material से हमको उनको cover करना है. Then for the allergen avoidance, use air purifiers and dehumidifiers. Keep windows closed and clean regularly. So if there are pets in our home, so pet management should be there. Keep pets out of your bedroom, bath them regularly. Keep your soft toys and stuffed toys in plastic bag and freeze to kill the house dust mites. Wash beddings regularly in hot water. Then mold prevention should be there and smoke-free environment. So these are the allergen avoidance tricks. So at the early stage, we can use the antihistamines to block the histamine release and to block or to reduce the symptoms induced by vasodilatation, itch, and mucus production. So these are the second generation antihistaminics, that is the chlorpheniramine, and the second generation antihistaminics, cetirizine, loratadine, and the fixofenadine. These are the oral antihistaminics, and the intranasal antihistaminics are the azilazine. So we can use it in late phase. In the late phase reactions, we can use leukotrienes. So in adults, this is the specific dosage of the leukotrienes antagonists, and this is the main recently we are using the montelukast. So these are the limitations of modern therapy. There is only symptom control, there is a not cure, and relapse on discontinuation. So in the clinical gap, nothing else can be done. Perception, patient drifts to the unverified treatments. So this is the, we can think or research focus on the mechanism of action of our nasya in allergic rhinitis and the nasal mucosa. So what happens in when we instill the nasya medication in the nasal mucosa? What really it acts on the nasal mucosa? What should be happen? As we discuss in the allergic rhinitis, the drama we have discussed, what happens? So we can think this point in our mind that what mechanism should be there with the medication we instill in the nostrils. So this mechanistic insights we can use by the modern lens, that is a direct mucosal barrier restoration is there. As we instill the oil or medicated oil in the nostril, so it actually mechanically act as a barrier between the allergens and the nasal mucosa. So it enhances the mucociliary clearance. The cilia present in the nasal mucosa, what actually they do? They capture the allergens or the dust, and it actually moves like a, we can say it as a blanket in the nasal mucosa to clear the mucus that produced in the nasal cavity or sinuses. So it is drained as a mucociliary clearance. So enhancement of the mucociliary clearance is there. So it also acts as an antioxidant. So the barrier effect of the nasal mucosa. So we can think about the nasya like this. So Pratimarsha Nasya. So what is a Pratimarsha Nasya? This is a Nasta Snehanguli Dadya Prati Prataha Nishisha Sarvada. एक उंगली जब automatic करना है, that 2-3 drops whenever we do it daily practice and there are specific timings that are mentioned in our classical text. That is the after morning or in the morning on walking, after brushing, before going outside. So these are the specific skalas which are mentioned by our acharyas. So क्या रोल है इनका, मतलब स्पेसिफिकली क्यों बताए गए हैं इतना स्पेसिफिक? मगर अगर हम सोचते हैं एज अ रिसर्च पॉइंट, तो इन ईच एंड एवरी पॉइंट पे हम लोग एक बड़ा रिसर्च या बड़ा टॉपिक कर सकते हैं कि हम सोच सकते हैं कि ये जो टाइमली प्रतिमर्शन से जो दिया गया है वो एज अ प्रिवेंटिव, एज अ थेरेपेटिक वी कैन यूज इट. जैसे पोलियो की सब लोगों ने ऐड की थी कि 2 बूंद जिंदगी के, अगर वैसे ही हम लोग 2 बूंद एलर्जिक राइनाइटिस के लिए अगर प्रतिमर्शन नस्य को हम लोग थोड़ा सा वायरल कर दे तो वी कैन save the burden of the or frustration of the allergic rhinitis patient. So what actually it acts as a prophylactically before the allergen exposure. घर से बाहर निकलने के पहले हम लोग प्रतिमर्शन नस्य या 2 बूंद नस्य कर रहे हैं. उसके बाद it reduces frequency, intensity and chronicity of the allergic rhinitis. It maintains mucosal integrity and the immunity. So this is the scientific explanation how Pratimarsha Nasya benefits allergic rhinitis if given at the classical timings. So if it is instilled in the morning on walking, so peak of the kapha dosha, that is the morning kala, and the nasal congestion that happens overnight if there is a continuous allergic hypersensitivity in the patient. So if patient he or she complains about the or anosmia or headache or whatever symptoms, so allergens may activate overnight. So it will this scenario, and the effect of the it clears the congestion, improves airflow, and soothes the mucosa. After brushing, so after brushing there is a oral nasal hygiene link. So brushing may stimulate the nasal mucus. So it enhances the mucosa clearance, improves the delivery of the medicated oil. Before going on side, it will act as a mechanical barrier between the allergens and the nasal mucosa, and it may trap the allergens. After exercise and walking, after walking or exercise, there is a vata dosha or there is a vata prakop. It may whenever there is vata prakop, there is a shishta drying and the drying of the nasal mucosa, it can irritate the nerve endings and it can start the hyperactivity. So sneezing started. So what after exercise or after walking, if we instill the Pratimarsha Nasya 2 boots, then it will lubricate the nasal epithelium and stabilize the secretions. After urination, defecation, and after the Apan Vayu, same vata provocation may increase the nasal dryness, so it will reduce the hypersensitivity. After meal, postprandial nasal congestion is there in which is common in the allergic individuals. So Nasya balances post-meal kapha dominance. After Shiro Abhyanga, Anjan and Kaval, so these local therapies stimulate the cranial circulation. So Nasya supports upper respiratory immunity via olfactory limbic neuroendocrine connections. So it's all about the Nasya. It may be Pratimarsha Nasya or classical Nasya, which can act as a immunomodulator in the allergic rhinitis. So role of the Swarna Prashana in management of allergic rhinitis. Allergic rhinitis is mainly we can see the scenario which goes on families to families. मतलब एक फैमिली में अगर एलर्जिक राइनाइटिस है तो उस फैमिली की शुरुआत, दिन की शुरुआत छींकों से हो जाती है. सुबह उठे तो छींके, रात को छींके, धूल में गए छींके. So मतलब पिताजी को है, बच्चे को है, फिर छोटे बच्चे को है. सो अगर ये सब हमको स्टॉप करना है तो why do we think about the स्वर्ण प्राशन? छोटा बच्चा है तो तभी हम लोगों ने अगर स्वर्ण प्राशन स्टार्ट किया तो ये जो हेरिडिटरी एलर्जिक राइनाइटिस का सिनारियो चलता है इसको हम लोग रोक सकते हैं. सो रोल ऑफ द स्वर्ण प्राशन इन मैनेजमेंट ऑफ द एलर्जिक राइनाइटिस. So it is the definitely scope of research needed to validate it. So scientific rationale for swarnaprashan in allergic rhinitis, it may be the mechanism of hyposensitization. So modern allergens immunotherapy, what they do, they work by gradually desensitizing the immune system to the allergens. छोटे छोटे shots उनको एक specific duration पे देते हैं. तो हम लोग swarnaprashan में भी क्या कर रहे हैं, specific duration पे हम लोग specific एलर्जेंस उसको प्रोवाइड कर रहे हैं. जो एलर्जेंस कहाँ से आएंगे, मधु जो हम लोग उसमें यूज कर रहे हैं, दैट मधु इज अ कलेक्शन ऑफ डिफरेंट पोलेंस फ्रॉम वेरियस फ्लावर्स और वेरियस फ्लावर्स. तो उतने सारे पोलेंस को हम लोग बॉडी में छोड़ रहे हैं. सो इट मे बी द मैकेनिज्म ऑफ हाइपोसेंसिटाइजेशन. सो इट वुड वर्क ऑन द दिस फिनोमेना. सो इट विल एनहांस ऑन द नॉन स्पेसिफिक इम्यूनिटी, रेगुलेट साइटोकाइन balance, improve mucosal barrier immunity at the nasal level, or it may improve Agni, Bala and the Ojas. So Ayurvedic immunity triad, we can work for it. So these are the biomarker changes with Swarnaprashan. So these are the supporting studies which are already conducted on these biomarkers of the immunity. So total IgE level is reduced by 15 to 25%, and it is the study conducted by CCRS Ayurved trials 2019. Then eosinophil percentage in the nasal cytology, which reduces the inflammation. This is the pilot Rasayana trials in the AR patients. So this is the main factor or main direction to which we can think. So these are the effects of nasal mucosa on the, as per the Ayurvedic and modern correlates. So Kapha Vata predominance in the Pratishaya. So there is the modern interpretation, that is the inflammatory eosinophilic mucosal state is there. Nasya and Rasayana improve the mucosal function, restoration of the mucociliary clearance and the epithelial integrity. And Swarnaprashan enhances the Oja. So that is the immuno enhancement, reduced mucosal hyperactivity, hyposensitization is there. So one more thing or one more point we can think about the saline wash or the nasal irrigation, that is the Jalaneti. We can habitually अगर इसकी practice करते हैं, daily routine में इसको अगर लाते हैं, तो we can also reduce the burden of the allergic rhinitis or the symptom score, we can reduce it. So what happens in the Jalaneti or nasal irrigation? क्या करता है ये? If nasal irrigation with high volume or low pressure, or low volume with high pressure, so it directly cleans the nasal mucosa, removal of mucosa and inflammatory mediators, reduces bacterial burden, reduces mucous thickness, and it improves the mucociliary function. So this is a roadmap या एक collaborative work जैसा इसमें बना है जो हम लोग कर सकते हैं. This is the mechanism of scientific interpretation of Medhya Rasayana with T-regulatory selectivity immunomodulation, which happens in the Swarnaprashan. Then Ojas Vardhan, Vyadhi Kshamatva Vardhan, then antioxidant, and the biomarker study we have already discussed. Then Rasayan therapy. So Gudichi, it is an immunomodulator. Haridra, anti-inflammatory, and acts on the histamines. Yashti Madhu, it soothes the mucosa, and it also acts as a anti-allergic. Amlaki, known Rasayan drug is there. So these are the biomarkers studied on Rasayan therapy. So eosinophil count रिड्यूस होता है. हरिद्राखंड एक वेल नोन मॉड्यूलेटर है जो हम लोग यूज कर सकते हैं. दिस इज द नस्य थेरेपी. So as we discussed in the Kshavatu and Brahmantu treatment, that is the Snehik Dhumapan. So what will happen with Snehik Dhumapan? अगर Snehik Dhumapan हम लोग करते हैं, क्या commonly use किया जाता है Snehik Dhumapan में? हरिद्रा, यष्टि मधु, गुगुलु, घृत and सिक्त. इससे हम लोग Snehik Dhumapan करते हैं. So it will act or it will improve the mucociliary clearance, anti-allergy and anti-inflammatory action of these drugs. Then neural desensitization is there. immunomodulation is there, and antimicrobial protection is there. So it will eventually act on the Shavatu or Branshatu, and it break down the samprapti of the allergic rhinitis or Vatach Pratishar. So Dhumapana offers a multi-targeted approach in allergic rhinitis. It clears the kapha, controls sneezing, modulates mucosal immunity. So it is an ancient tool with a modern impact on allergic nasal disorders. So this is the integrative protocol proposal for the Ayurvedic hyposensitization. It should be Shodhan, Liberation or Nasya, which reduces kapha and prepare the system. Jalaniti, we have discussed, Swarna Prashan, Nasya, Rasayana, and the Snake Dhumapan. So these are some immunomodulatory herbs which act on the allergic rhinitis, and these are the studies which are already conducted on the Guduchi, then Haridra, Sidopaladi Churna, and the Ashwagandha. So this is all about the allergic rhinitis, and key take-home messages. The patient-practitioner gap in allergic rhinitis is driven by underestimation of the disease burden, communication lapses, and suboptimal guidance adherence. So bridging the gap requires structure assessment, patient-centered education, shared decision-making should be there, optimized pharmacotherapy, systemic follow-up. Using validated control tools and integrating modern and classical health solutions can substantially improve the outcomes. So, thank you.
Thank you so much, Sarika ma'am. It was such a wonderful and engaging presentation. So I take opportunity to request National Convener of Vishwa Ayurved Parishad Shalakyatantra, Dr. Professor Vijayant Bhardwaj sir, to please give the words of appreciation to our eminent speaker. Over to you, sir.
Thank you, Lotiga doctor. Is there any question from the audience?
Sir, I already posted here that if anybody wants to ask any question, they can post their questions in the chat box, or they can raise their hands. Better would be if you post your questions, because they cannot speak in this meet, as it is very much organized one. And so I request everyone to just post your questions in the chat box. We'll take your questions one by one.
PG students, are you there? You can ask. Yeah. Post in chat box. Postgraduate students and faculties who are there. Integrated approach we daily are doing.
Current and most prevalent topic nowadays. Now we are dealing with such cases. We are having enough of such cases. So students and PG scholars might be having their queries. Dr. Rajiv Soni. Dr. Rajiv Soni, if you have any query, you can just post your question in the chat box. Are you able to? Arun sir, I don't think we have any question right now.
Yes, ma'am.
Okay,
I have a
okay,
question, ma'am. Can I ask, ma'am? Yes.
Yes, yes.
Yeah. So, yes, ma'am. Swan Prasan is one of the best part of your, and we will surely start Swan Prasan, your practice for allergic rhinitis. Ma'am, what are the gold preparation you have used in such kind of patients?
Gold preparations.
Yeah.
स्वर्ण प्राशन केस में बात कर रहे हैं आप कि अलग स्वर्ण गोल्ड प्रिपरेशंस you are asking about?
Not Swan Prasan. I mean gold preparation for adult.
What is the role of gold preparations in allergic rhinitis patient?
No, I have not tried any specific gold preparations. Just I am trying Swarna Prashan since 2012. So reduction in the allergic rhinitis symptoms I have been watched since years, but study should be there and documentation should be there to prove our modality or our treatment. So documentation should be there, sir. I have never tried any specific gold preparation for the allergic rhinitis. I'm concerning about Swarna Prashan only.
Rasa Sindur
Ma'am, how we have to use
helps her out. Rasa Sindur.
अच्छा नाही मी नाही ट्राय केलेलं.
Rasa Sindur आणि Samir Pannagras. That just
Okay.
like a
Your voice
Ma'am,
is
you're not
breaking.
audible. Yes, ma'am, your
Your-
voice is breaking.
Voice is breaking.
Okay, okay,
Actually,
okay.
I'm not audible.
No,
not
no,
audible?
you're audible, ma'am. Yes, yes.
Voice is
So
breaking.
in
Now
that,
audible, but
Arun
voice is
Kumar ji,
breaking.
आपने जो question पूछा है, I would like to throw light on this particular. You are asking whether madam is using any gold preparation. So I would like to share my experience because we are using many rasakalpas like Mahalakshmi Vilas, right? Then Samir Pannagras, Rasa Sindur, this kind of things. Swarna itself is a immunomodulator. That's why Swarna Prashan help us out ना. Swarna Prashan में भी है, तो महालक्ष्मी विलास रस का बहुत अच्छा रिजल्ट है. और नस्या जैसे
Yes, ma'am.
बताया है कि डेली
Nardiya Lakshmi Vilas is
नारदीय लक्ष्मी रस कल्पास आर हैविंग अ बेटर इम्पैक्ट ऑन दिस पर्टिकुलर स्वर्ण इटसेल्फ इज
Actually, there are two aspects to treat the patient. One is prophylactic and another is the treatmental part. And if you are using these drug Lakshmi Vilas Ras or something Hartal or Manshil preparations, they are treatmental part. And madam has given us the input about the Rasayana Chikitsa that can be prophylactic also.
Yes, 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 sir. Right, sir. There are two parts: prophylactic and preventive.
Yes. And madam have left
sit out.
Sorry.
Please,
Yes,
sir.
sir.
Please.
Madam has not given her input about the radiological findings, and these radiological findings should be there before treating the patient. You have to see the sinuses aspect first. If there is
Yes.
involvement of maxillary sinus, then we have to give antibiotic or something which can prevent the infection also. And if the patient is having ethmoidal infections, then we can treat the patient as allergic condition.
Yes, sir. I have already mentioned that rule out the sinusitis and these are things. Just I have not focused
Yes.
on the
Yes.
radiological aspect of it.
Yes, ma'am. Yes.
Ma'am, how we have to use Swarna Prashan in these cases?
In these cases, if there is a family history of allergic rhinitis, so we can start in the bachus, at the age of whenever they will approach you, you can start the Swarna Prashan at the monthly basis or daily basis. If severe symptoms are severe, severity is there, we can start the Swarna Prashan on the daily basis.
Actually,
So it is the preventive part.
Preventive part. I am focusing on the preventive part.
Actually,
Fine,
there are two things. One is familial etiological factors.
Huh.
If patient is having one parent allergic symptoms, then the child may be having 20% of these allergic symptoms. If both the parents are having these allergic symptomatology, then the child may be having 30% of pathology. And to prevent this, if we are knowing that the patient's parents are having allergic conditions, then there is sure that child should be having this symptomatology. Then we can use these Rasayana Chikitsa or preventive measures.
Yes, sir.
Actually, there is a special chapter, Sushruta Uttar Tantra, chapter number 24. If we go through the care and we think how important role of Snehana. You breathe it.
सुनीता मैम आपकी आवाज नहीं आ रही।
हाँ वॉइस ब्रेक हो रही है।
सुश्रुत उत्तर तंत्र चैप्टर नंबर 4.
24 not properly.
Every person who still not properly. Abhi not audible. Hello.
You are audible.
Not audible.
सुनाई दिया मैम। Yes मैम audible मैम।
Not audible.
No.
Network problem.
There is some network problem मैम।
Okay, ठीक है. Let it be. Carry on, sir, Bharadwaj.
Okay, ma'am. Okay. One thing which we should have to do is the counseling of the patient. If we are counseling the patient properly by giving half an hour or hour to the patient, that can prevent the disease up to 50%. We are not in a position to give treatmental part to every patient for a long time, because this disease is not curable by any means, Ayurvedic or in modern also. We can check the symptomatology only. So for the prevention point of view, we have to give more counseling to the patient by giving half an hour or hour to the patient.
Yes.
Anything else, Dr. Lotika?
Yes, ma'am. Sir, we have a question from Dr. Rakshri. He is saying that if allergy is an immune response, then what would be the probable role of immunomodulator? We were using Guduchi and it is acting as an immunomodulator. If it is an immune response, then is there any use of immunomodulator? Hello.
It was not clearly audible.
Revise the question. Clearly, revise the question, please.
Rajshri was saying that if allergic rhinitis is like allergy we have related there. It is an allergic response. Then is it mandatory to give some immunomodulator, or is there any role of immunomodulator in it?
The voice is not clear.
Hello. Am I audible, ma'am?
Yes.
मैम डॉक्टर राजश्री सेइंग कि अगर ये एलर्जिक रेनाइटिस एक एलर्जिक प्रॉब्लम है तो इज देयर एनी नीड कि हम इम्यूनोमॉड्यूलेटर दे रहे हैं तो उसका क्या मोड ऑफ एक्शन रहेगा इम्यूनोमॉड्यूलेटर का?
Immunomodulator, I have already discussed that immunomodulator acts on the nasal mucosa, so it will act on the specific levels are there. So it will be act on the histamines. So it may act on the leukotrienes. So this is the part of the research. So it can be let it be. But Guduchi as an immunomodulator, we have already discussed that studies already stated that, and it shows the reducement of the total nasal score is reduced with use of the Guduchi and the Haridra, Yashti Madhu. So it will act as a immunomodulator.
So she is saying that it will act as immunosuppressant or immunobooster.
This is part of the research. We can specifically.
Okay. Yes, we cannot say like that. Right, ma'am. Then we have question that when and for how long Jal Niti must be given.
So it is the daily routine practice. We can use it daily. No?
So we can
Whenever
use it
there
daily.
whenever there is severity of the symptoms, we can use it daily. In between, we can stop it.
Okay.
Actually, can I add?
Yes, sir. Yes, sir.
Yes.
If we are using Jalneti, then we have to first see the concentration of the saline. If you are using hypotonic solution, then you can use up to life also. And if you are using a hypertonic solution, then it can be used for disease purpose only.
Okay, sir.
Yes, sir. Yes.
Any other question from the participants? You can post your questions like others are doing. Yes, ma'am. These were only the questions we were having.
Okay. Should I start now?
So, yes, for sure, sir.
Okay. And good afternoon, everyone. It's my pleasure to propose board of thanks and welcome to Dr. Sarika, Palve ma'am, BMS, MS Shalakya, PhD scholar, professor and head in the College of Bhausaheb, Mulak College, Butibori, Nagpur. She has given her input about the allergic conditions, and I think every OPD is having third patient, third or 40% of the patients are now having allergic symptomatology. So she has wisely chosen the topic, which is very common problem in ENT. She has nicely placed her views about disease and the treatment part also. I think every person attending this webinar might be benefited. So I thanks Madam giving your valuable inputs and engaging presentation. I would also like to thank Madam Srita Magar ma'am, who has given her inputs about this topic as well as organizing this webinar. I would also like to thank another member of the organizing committee, which has dedicated in making this webinar successful. We are deeply grateful to the Vishwa Ayurved Parishad, who has given us the platform to discuss about Shalakya diseases. Finally, I would like to thank all the participants who has spared their valuable time to make this webinar successful. Thank you you all for this good evening lecture.
Thank you, sir. Thank you, ma'am. Thank you.
Thank you, Vijayan sir. And thank you so much, Sunita ma'am, for introducing such pearls in Ayurveda. We are very much unaware about such beautiful pearls. Like what the achievements you told, your voice was breaking that time, but this platform is having Gemini in it. So I just read what you told was, I don't think all the participants have heard it properly, that ma'am has reached 1300 tribal areas. Ma'am has got 3 patents and 3 books. Meeting and hearing such wonderful persons on this platform is actually that we are achieving something in our daily life now. And sincere thanks to Vishwa Ayurved Parishad team, through which Shalakis are actually receiving such thoughtful lectures nowadays. So now at the end, I would like to request Dr. Arun, who is coordinator of this Vishwa Ayurved Shalakyatantra. Please say a few words and end up with the
Thank you,
Shanti part.
ma'am. Thank you, Dr. Lotika. Definitely a great lecture. Very dissected every point, each and every point, the diagnosis, the signs, symptom, everything is wonderful. And the line of treatment, the compilation is very nice, ma'am. Thank you very much for such a nice lecture. Thank you, Sunita ma'am, for arrange ma'am for us the beautiful lecture. Vijan Bhardwaj sir, Lotika, all the team of Shalakyatantra, all the journal member, especially Vishwat Parishad. Thank you. So now we are end of the sessions with the Santi Mantra. Please join us in Santi Mantra. Sarve Bhavantu Sukhina. Sarve Santu Niramaya. Sarve Bhadrani Pashyantu. Ma Kasyid Bhave. Om Shanti Shanti.
Shanti, Shanti.
Thank you, ma'am.
Thank you.
Good night. Good night to
Thank you,
everyone.
sir.
Thank you,
Thank you,
ma'am.
ma'am.
And ma'am, I'll share the certificate, ma'am, just to Sarika, ma'am. After that, thank you, ma'am. Thank you
Thank
very
you.
much.
Okay, thank you all, madam.
Thank you so much, sir.
Thank
So
you.
we are ending the meet. Thank you, sir.
Yeah, just I stopped the recording.
Good night to everyone.
Goodness.
Good night, sir.